our health care. I can't vote those people out of office.
I feel like I'm under tyranny.
But you keep passing things, funded mandates.
All right, those remarks not from the town halls of last summer, not even from the spring. That came from a town hall in North Carolina last night, held by Senator Kay Hagan. With healthcare opposition still running deep, some White House allies now warning Democrats not to oversell the legislation. Here's a so-called list of don'ts from Democratic pollsters as reported by Politico. Don't say the law will reduce costs and the deficit. Don't barrage voters with a long list of benefits. And don't pat yourselves on the back too much. Let's talk about it with Nancy Skinner. She is syndicated radio talk show host. Nancy, great to see you today. Happy Friday.
Hi, Shannon. You too.
All right. All along, we heard Senate Majority Leader Harry Reid and others that once people got to know more about health care, they would appreciate it. They would be happy they had it. So why remessage now as voters are just weeks away from going to the polls?
Well, they aren't re-messaging. What they're doing is saying, you know, we haven't talked enough, in fact, Shannon, about some of the benefits of health care. So, you know, September 23rd, for instance, you'll have the pre-existing condition exclusion for children taken away. So if I have a kid with asthma, I don't have to worry about being stuck in my job. That's just weeks away. No one's been talking about that. So what these groups have been saying is stop talking exclusively about the macroeconomic costs of this, because people want to know what it means to them. If it means that I won't have a lifetime cap and that my kid can stay on coverage till they're 26 and that all preventive care is covered at no cost, that's quality of life, because we're going to be catching cancers in stage 1 and not 4. So yes, that reduces cost to treat it, but also it's a better quality of life when you're able to get care early, treat things, and move on with life, and nobody's been talking about it. So that's what they were saying in that PowerPoint.
All right, let's talk about public perception, because the polling has been going on for well over a year on this topic as it's played out in Capitol Hill and all the way through getting it passed, and now people learning more about it. I mean, if you look at Real Clear Politics, which has tracked this over time, currently they say the margin
over, and people chose 55 to 41%. They would rather go with a Democrat who's saying, let's give it a chance and fix it where need be, than the straight repeal message, because time, you know, with time, and as we discuss this, and it's not all the boogeyman monsters about death panels don't transpire, then people realize, hey, you know what, this I could get small business tax credits. My small business employer that I've never gotten coverage from will now have help, and I might get coverage working in a small business. And I think this is actually a Democratic issue they should campaign on.
Well, they are getting some advice to tone it down from this group, Families USA, that we talked about, that was amazing. To get this passed. First of all, I thought it was astonishing. One of the things they found that a lot of people, there's a segment of the U.S. society that doesn't even realize that health care reform got passed. That's confusing, you know, as a whole. But there are a lot of people who worry about how this is going to impact the economy. They're expressing concerns over that. And of course, now as we're seeing that the economy with most voters is the #1 issue going into the fall, are these two now going to be linked? Will people say, I'm worried about the economic impact because of what they don't understand about health care? And is that going to be some sort of backlash on Democrats?
Well, the economy is the #1 issue, no doubt. That's why health care has kind of fallen off, actually, from earlier this year. But then you track back to the argument that the health care bill, long-term, is the only thing that's going to really bring our long-term deficits under control. That is still true. And healthcare economists from across the political spectrum realize that when you bring everybody into the insurance pool, you bring down the cost of delivering health care, our economy is going to be better off. So, yeah, we can circle back to that argument. And I don't think that people should stop talking about that, frankly. I disagree with these pollsters who say don't bring that up. I don't think they're saying don't bring it up. They're saying stop emphasizing it. Talk about the real-world benefits to real people, college-educated women. As you say, a lot of them don't even know that it passed. So we have a real communications challenge on our hand here. It passed. It's going to be good for you, your family, small businesses, right starting now and get better as it gets put into place. And it's going to, in the long run, be the thing that helps our long-term deficit picture.
All right, we'll continue to watch the polls and see if voters out there are convinced. Nancy Skinner, great to see you. Thank you.
You too.